Hi, my name is Lily. I am a sophomore nutrition student from UMass Amherst. And in this video, I'm going to talk about what role exactly does zinc play in this COVID pandemic, and would adequate intake of zinc reduce the infection rate or the mortal rates after being infected. So here is our topic for this video, and let's get started. Since we are already relatively familiar with this topic by this time, I'm not going to elaborate on the background story, but I would like to point out some things that's worth mentioning for better understanding of this video in particular. So first of all, let's notice that we are talking about a COVID-19 pandemic. It is not the name of the virus. The name of the virus is SARS-CoV-2, and that stands for Severe Acute Respiratory Syndrome Coronavirus Type 2. That is the name of the virus. COVID-19 is just a description of an infection disease caused by this virus that has been spread overseas. Looking at this image of coronavirus on the right, there are a lot of spike-looking things pointing out from the membrane of the virus, and these are called S proteins or the spike protein. And when they bind with a transmembrane receptor on the healthy human cells called angiotensin converting enzymes or ACE2, this will gain access for the virus to enter the cell and infect that cell it targets. So we're going to remember this, and we'll get back to it later. So, what is zinc? Zinc is an essential trace element that plays a key role in many systems. It functions as a signaling molecule for modulating inflammatory responses, and is also a cofactor to more than 300 enzymes. It promotes the growth and development of cells, and this indicates that it could work in many places in our body, such as wound healing, and maintaining a membrane integrity of the cells by stabilizing cellular structures. It also helps bone formation and heme synthesis that's forming new blood cells. It also plays a crucial role in synthesizing genetic materials like DNA and RNA, and that's important to cell division. So now it comes to sperm health. So in many cases of zinc deficiency, it could lead to infertility of males as a result of insufficient amount of healthy sperms. Zinc also helps regulating the release of hormones, especially sex hormones, and that means it will relate to our sexual maturation. It is also important in neurotransmission, and that's relating to the development of our neural impulse network. And last but not least, zinc also plays a key role in immunity support because it is essential in the proliferation of immune cells. It forms the antioxidant defense network that regulates the oxidation reactions that could result in unwanted damage in the cells. And it maintains the activity of lymphocytes, that's the B and T cells, and leukocytes. Or I should say other leukocytes, because lymphocytes is already one kind of leukocytes. So we'll have the neutrophils, the basophils, and the monocytes, etc. Now it comes to deficiency, and that's pretty much just the opposite of what we just discussed. So delayed maturation, poor wound healing, and immune dysfunction. So how is zinc related to COVID-19? This following figure is from a review article from International Journal of Molecular Medicine, and it shows the proposed mechanism of zinc in COVID-19. So firstly, zinc could improve the clearance ability of the mucociliary located on the epithelium layers of the respiratory tract. Oh, I forgot to mention that the arrow symbol represents upregulation of whatever the process was going on, and is enhancing or improving certain ability of that process. And the one with the line cap represent inhibition, and that's a stop or prevention of whatever is going to happen. And now we have this viral particle coming from the environment into our lungs via the trachea. And in this case, with zinc present, we are actually going to increase the beating frequency of the cillaries and the length of it. And this action is actually going to help to remove this viral particle and prevent it from actually entering our lung. And it's also going to help to reduce the risk of having a secondary bacterial infection, because with ciliary mechanism is not only going to just remove the virus, it's also going to remove most of the particles in the air, including bacteria and pollen that could result in an allergic reaction. So let's do a little review on how the virus look like. So if you remember from several slides ago, we have this spike looking things on the surface of the virus. These are called the S protein or the spike protein, and they are the key of how this virus get into our cell and infect that cell. So we have this transmembrane receptors called angiotensin converting enzymes, or ACE2, that in normal cases is going to pair with a protein called angiotensin 2 and will downregulate its function and result in decrease in blood pressure and inflammation. However, in this case, it is actually used by the coronavirus as a way to enter our cell. So with zinc present, zinc is actually going to inhibit the formation of ACE2, or at least decrease activity of that receptor, and in that way, it's much less likely for us to be infected by the virus. Moreover, zinc directly inhibits the RNA-dependent RNA polymerase of the SARS-CoV-2, meaning that it is capable of limiting viral replications directly. Okay, so now I'm just going to erase this page so that I have some space for notes. So number 3, we're going to talk about the alpha interferon, and that is a regulatory protein that's secreted from many lymphocytes or white blood cells to defense against pathogens. And that will eventually end up with an improved antiviral immunity of the cells. Next, we're going to talk about how zinc can inhibit many of the pro-inflammatory factors that can lead to uncontrolled or unregulated local and systematic inflammatory responses. And that is known as the cytokine storm. And we don't really want way too many of the immune responses because we don't want things to get out of control and become unregulated and ends up with a deadly disaster overall. Lastly, zinc could also help to reduce the risk of having a co-infection caused by bacteria. And they do this by inhibiting the likelihood of having a bacterial homeostasis that will promote the bacterial cell growth. And inhibiting this growth, zinc helps decrease the likelihood of having an infection. Many researchers have found that people with zinc deficiency are generally more susceptible to respiratory infections, and they're thus more likely to be infected by COVID-19 viruses, which mostly target cells in the respiratory tracts. And looking at this risk factor list, we can conclude that people with higher risk of having a zinc deficiency do have a higher risk of having a higher mortality rate for COVID as well. So, in summary, zinc could protect the human body by decreasing the activity of the receptors ACE2 and improve the clearance ability of the mucociliary that remove the viral particles before it actually enter the lung cells. And zinc is also believed to be capable of limiting viral replications by preventing transcriptions from happening, as it inhibits the RNA-dependent RNA polymerase that's crucial for that steps. It reduces the risk of having a co-infection by bacteria and enhance the antiviral immunity of the cell by upregulating the interferon alpha. It also enhances the anti-inflammatory ability of the cell by inhibiting the production of the pro-inflammatory cytokine molecules. And for some recommendations for zinc supplement intake, according to the dietary reference intake, they recommend a daily intake of 11 milligrams of zinc for males and 8 milligrams for females. It's worth mentioning that the maximum intake of zinc should not exceed 40 milligrams a day for a healthy human being, and you can find zinc in oyster, shellfish, nuts and seeds, and legumes. The suggested intake for zinc should be given individually to the patients because some factors like height, weight, gender, dietary habits, ages, etc. could introduce variations in recommended dosage of the supplements. Some patients may also experience absorption problems that could be related to aging as well as other factors that might contribute to decreased intestinal functions. Moreover, although we generally don't have much zinc storage in our body because they got excreted out pretty easily, we still need to pay attention to the side effect of excessive zinc because it would decrease the absorption rate in copper, and with that said, patients could end up with problems like low white blood cells count and muscle weakness as well as anemia. Anyway, more researches are still needed to be done in order to establish the appropriate dosage of zinc to improve the survival rate of the patients. That concludes today's video. Thank you for watching and I hope you have a sparkling day.